Hi, good afternoon, Mister. Long-term outcome for partial oral entertainment or endocarditis. Definitions. It is the inflammation of the internal lining of the volvulus and caveat, endocardium, caused by the invasion by microorganisms, usually bacteria and ground forming some characteristics strong enough of the vegetations.
Endocarditis means inflammation of the inner layer of the heart. The heart's wall is made up of three layers, the epicardium being the outermost layer, then the myocardium, and then the endocardium, which is the layer that gets inflamed. It turns out that most cases of endocarditis are due to microbial infection of the endocardium, usually involving the endocardium lining the cardiac valves. Watch the full video on osmosis.org.
Application in nursing. Control of vital signs. Specialty despite temperature. Temeling treatment with my antibiotic and sun and blood culture and alternate. Heart intonation to family member about to heart car they point the child. Receive control pain. Video.
Hey guys, Nurse Mike here, and welcome to SimpleNursing.com. Before we get today's lecture started, please remember to access your free quiz and preview our cool, nifty new study guides, not here on YouTube. Click the link right up here at any time during this video. All right guys, let's begin. So the easy way to remember all the main causes, use our acronym DRUMS, because your heart kind of acts like a drum. So D is for dental or oral surgery. We give prophylactic antibiotics, and also degenerative heart disease called Marfan's syndrome. Now R is for resistance to major antibiotic. Even if your patients take these prophylactic protective antibiotics before their dental appointments, guys, they might not even work if they have long-term resistance to major antibiotics. Which brings up our next point, U. U is for untreated strep throat and even untreated rheumatic fever. This is a main cause here, huge test tip. Untreated strep throat can lead. Hey guys, Nurse Mike here, and welcome to SimpleNursing.com, aka rheumatic heart disease, and then to endocarditis, and then to death. Who would ever thought that a sore throat could lead to a broken heart? So M is for major heart surgery. We all know that repairing heart valves can be risky, but even CABG, so yes, a CABG, a coronary artery bypass graft for heart attack patients, or even implanting pacemakers. So guys, anything that opens the heart up during surgery to any possible infections is a huge risk for endocarditis. And lastly, S is for sticking dirty needles, even for medical use, tattoos, and even piercings. Guys, anything that opens your body up to infection, whether it's opening your chest for heart surgery or opening the skin with dirty needles, or even opening your gums in dental surgery. It all revolves around protecting your patients from infection. So guys, especially patients with history of heart problems, they're the most at risk. Now for diagnostic tests for infective endocarditis, we do both blood cultures and an echocardiogram. The blood cultures help pinpoint which kind of germ it is so we can match it better to a drug that will kill it best. This is called. Thanks for watching. For our full video and new quiz bank, click right up here to access your free trial. And please consider subscribing to our YouTube channel. Last but not least, a big thanks to our team of experts helping us make these great videos. All right, guys, see you next time.
Yeah, taking off.
Pros and cons. The pros, my chances and pains. is early diagnosed, and temporary of the endocarditis is performance. Performance blow cultural surveillance, the increase on the temperature. Treatment is early surprise is an aiming at the province multidisciplinary surveillance and symptomatic management or complement. BTO.
Hey guys, Nurse Mike here, and welcome to SimpleNursing.com. Before we get today's lecture started, please remember to access your free quiz and preview our cool, nifty new study guides, not here on YouTube. Click the link right up here at any time during this video. Alright guys, let's begin! Now, infective endocarditis is not only caused by throat infections. This strep or staph infection can also enter the bloodstream from many other ports of entry, either from dirty needles or even dental procedures. Either way, the little bugs enter the bloodstream and find their way to the heart, where they nestle into small cracks in and around damaged heart tissues, and even around newly placed valves where the tissues are still healing after surgery. Once they locate an opening, the germs set up a nice little home for themselves, most commonly on the left side of the heart, in the mitral valve and the aortic valve. This little party grows little by little into a big rager, eventually clogging the valve doors in the heart, which impairs the pumping action. This impaired pumping can be heard in a weird little swooshing heart sound that sounds a lot like this. Now, this eventually leads to a less forceful contraction in the heart, meaning less oxygen-rich blood being pumped out to the body. And guys, again, less cardiac output means less oxygen to the body. Now guys, before you try to memorize all those signs and symptoms, always recall in your mind the pathophysiology first. It makes everything a whole lot simpler. All right, so what's really going on? Well, infectious vegetation starts growing on the heart valves, right? And this makes it hard for the heart to keep a tight seal and pump correctly. This leads to low cardiac output, causing low oxygen to the body, and in severe cases, it can lead to heart failure for the heart to pump. So we use the acronym CLOT, C-L-O-T. The C stands for clots in the heart and body, either from the swirling of blood in the inflamed heart or even breaking off of moldy vegetation. Thanks for watching. For our full video and new quiz bank, click right up here to access your free trial. And please consider subscribing to our YouTube channel. Last but not least, a big thanks to our team of experts helping us make these great videos. All right, guys, see you next time.
Cons. Endocarditis can compromise the myocardial valves on the lining of the heart. Some people with a wet teeth with endocarditis have a congenital anomaly on the heart, and damaged or abnormal heart valves, a new heart valve often suggests congestive heart failure. Using a plate in Ecuador. Student carried on 2002 an incident of 1-7 cause heart happers. Evaded per years and relation of hospitals. Finds in the incident in estimate at per 1,000. Elimination carditis is a rare infection with my index of the 17 cause on the average per years. Video.
I'm Peter Block at ACC 2019 in New Orleans, and with me is Henning Buntgott from Copenhagen. And he has just finished talking about an endocarditis trial. Henning, this is a little bit of a surprise as far as the outcomes are concerned. So I'm not going to give it away. You tell me what the trial is. It's a POET trial. Tell me how it works and how the trial was done.
We randomized 400 patients with endocarditis, and half of them were randomized to continued conventional intravenous antibiotic therapy, and the other half were randomized after a stabilization period to tablets, and those who were offered tablet treatment were offered to go home if possible.
So tell me how long that period was of stabilization? What does that mean?
Stabilization meant that the patients should be afebrile, they should have reduced levels of infectious parameters, and they should have a transesophageal echocardiography that was not worrisome.
Okay, so, and that can happen in what, 3 or 4 days, 5 days?
Now, they had to be on antibiotics for at least 10 days or 7 days after surgery. And in fact, they were randomized after 17 days on IV antibiotics.
Okay, so after 17 days of IVs, then they were sent home with their pills.
Those who were in the all arm were sent home after a median of 3 days with the pills.
Okay, so what are the outcomes? How did these do? I would say, well, my guess is they're not going to do as well, but in fact?
Yeah, and you say so because we have learned and we have the interpretation, all of us, that intravenous antibiotics are better as compared to if we take them as orals. But that's not the case, actually. This was a non-inferiority trial with a short outcome period of 6 months, and it was a bit better, but just met the non-inferiority criteria after 6 months. And now we have looked up for the first 3.5 years after finalizing, after randomization, a median follow-up of 3.5 years. And we do see a highly significant better outcome on mortality.
How can that be?
It's not related to infections. It's not relapse of infections. So it's probably not a matter of differences in efficacy of antibiotics. What we consider, we cannot explain it, but what we consider is that staying in hospital leads to a loss of functional capacity and mental capacity. So maybe those who stay in hospital, they just to have a picture of it, are sent home with a walking frame as compared to the others sent home with a walking stick. And we all know that life is shorter with a walking frame as compared to a walking stick.
Absolutely.
So that might be it. It is dangerous to stay in hospitals.
Yeah, well, we know that, right? Hospitals are not good for you.
Yeah.
Okay, so the short version of this, tell me if I have it right. Short version of this is if you have a patient with endocarditis, once stabilized and once taken care of and their infectious parameters go down, get them home on oral antibiotics.
Yeah, and then of course, you should do susceptibility testing for choice of antibiotics, and you should offer them 2 types of antibiotics on oral treatment, and you should follow them quite closely in the outpatient clinic, and the patients will fare a lot better as compared to present regimens.
Who knew? Whatever you learned in medical school turns out to be wrong. Thank you so much, Henning.
Thank you very much.
Conclusions. In a pain with my endocarditis that are in stable condition, oral treatment is inefficient. Outside and palliative therapy is suggested by my lateral review by pharmacokinetics. Consideration is the even the endocarditis continue to be challenges for health professionals because their clinical factors make and treatment of the condition complement. Video.
Endocarditis refers to inflammation of the inner lining of the heart, known as endocardium. This inflammation is a consequence of 2 factors, which are the presence of organisms in the bloodstream and the abnormal cardiac endothelium facilitating the adherence of the microorganisms and their growth. The risk factors for this colonization of the inner lining of the heart endocarditis is underlying structural valve defects such as right heart defect, congenital heart diseases, prosthetic valves, intravenous drug use, and bacteremia that is due to poor dental hygiene, dental treatment, heart surgery, IV cannula, especially the central lines, and soft tissue infections. This endocarditis can be classified into 2, that is the acute endocarditis and subacute. In acute endocarditis, it is a febrile illness which rapidly damages the cardiac structures hematogeneously, seeding extracardiac sites, and if untreated, it progresses to death within weeks. It is usually due to virulent organisms, which affects the normal valves such as Staphylococcus aureus and Streptococcus. The second classification is subacute, endocarditis, and this follows an indolent cause which causes structural cardiac damage only slowly if at all. It rarely causes metastatic infections and gradually progressive and less complicated by major embolic event and ruptured myocardic aneurysm. It is usually caused by organisms of low virulence and commonly affects valves that have already been damaged. The pathophysiology of this endocarditis involves the formation of the thrombi on the endocardium. Endothelial lining which has been damaged previously by infection and injury exposes the underlying collagen and tissue factors. This causes the platelets and the fibrin to adhere to the injured site, forming a tiny thrombosis. Then this therefore causes a non-bacterial thrombosis that's known as non-bacterial thrombotic endocarditis. Bacteremia delivers the organism to the valve surface, and the bacteria then sticks to the already formed non-bacterial thrombic endocarditis, causing vegetation and secreting adhesions. The adhesions therefore make the bacteria to stick together, creating a biofilm around this bacteria. This biofilm occurs in areas of low blood pressure, such as areas in low pressure artery surface in aortic regurgitation, and this eventually causes of intravenous drug uses of the predominance of tricuspid valve endocarditis. There will be mild CT scanning is helpful for localizing abscesses and electrocardiography. The diagnosis of infective endocarditis can be done by using the Duke's criteria. The treatment for endocrine obstruction, genitourinary system.